Our team came together because we were very interested in the experiences of women with psychiatric disabilities and their access to sexual health services. The three main goals of our research have been to understand what this access to sexual health services has been like, the barriers, the challenges. We're working on developing some recommendations in regards to access and equity. And we do all of this by utilizing a psychiatric disability-informed analysis to how we understand this work and where it's situated culturally, socially, and politically. And we're also doing this because we know that women with mental health issues can be at risk of sexual health vulnerabilities. It could mean sexually transmitted infections like HIV and AIDS. It could be unwanted or unplanned pregnancy. Women may have lower rates of contraception use. There's definitely issues of gender-based violence in childhood and in adulthood, or both. And we've also discovered that people experience a lot of discrimination with access to health services through primary care and even with mental health professionals themselves. We recruited our participants by reaching out to community-based agencies and to grassroots organizations, peer networks, places that we thought women would be going to connect with each other or receive services.
So trauma and violence emerged as prominent themes in our analysis. Many of the participants that we spoke with reported current or past experiences of violence and trauma, and this really profoundly impacted their need for, as well as the comfort accessing sexual health services.
I think the level of trauma I've experienced from being street involved and a sex worker, and basically all my boyfriends, is there a lot of services that can handle me? No, probably not.
One of the main reasons our participants described avoiding hospital-based sexual health services was because they felt that these services were not equipped, or else that they really weren't willing to take account of their trauma histories in delivering care.
Healthcare providers still don't know what to do when you say, "Oh, I have a history of sexual trauma." They're completely clued out.
So our study found that overwhelmingly women living with psychiatric disabilities preferred really to access sexual health services in the community.
I always stick to my community health clinics because they're used to poor sex workers who do drugs, and that's good for me.
So besides having a psychiatric disability, many of the women we spoke with experienced discrimination that was associated with other aspects of their identities or experiences, such as LGBTQ identities, experiences of poverty or sex work, and or racialized identities.
The truth has to come out about the way we're being treated, especially when we go into the hospital for health care, you know? We get all the stigma and the racism and shuffled off to the end of the corridor in the back room.
So our project's findings point to important implications for women's health, institutional and governmental responsibilities, and community mobilization. The overall lack of access to trauma-informed and trauma-specific sexual health services put women at risk as they delay or avoid preventative screening and treatment. The women we spoke with expressed strong preference for receiving sexual health services in community-based agencies that approach sexual health from both a relational and holistic perspective, and that consider the impacts of trauma. A more effective response from healthcare institutions might include supporting women-centered community-based services, standing in solidarity with and advocating for ongoing and sufficient funding to further develop trauma-informed sexual health programs that already have a history of meeting the needs for diverse women. Importantly, it raises questions about how to center the voices of women, how to center women's experiences with psychiatric disabilities in the creation and implementation of these services within community. So to say very clearly to women, you matter, your body matters, and you deserve high-quality, compassionate care.